Hmm. Dr. Donnelly did mention he thought that it's undereducated. In other words, very few people that understand it well and are taught it. But for those that are taught, it's overutilized. How do you react to his comments?
I think that could be said for anyone's approach. And I do believe it is important to have a foundation or a framework to your practice. And that's what the McKenzie system is to me.
Hmm.
However, um, if you give someone a hammer, everyone starts looking like a nail, right?
Hmm.
So if you don't have an open mind and your only tool is the needle, then I think that analogy there fits.
Yeah.
And I believe that's what leads people to do that. But I think at the same time, that's why within the McKenzie Institute, or not the Institute, but within the framework of the McKenzie system, people who've only taken that training probably lean towards making everyone a derangement at the same in the same light. So I would, I've worked in clinics where people certainly overutilize dry needling.
Hmm.
And I hope that answers your question.
Yeah, I think so. And I would say that, yes, there seems to be a common issue where those that are newly trained in MDT or McKenzie method tend to want to find those derangements. And therefore, just like Dana Green, I remember from way back on the podcast, and he said he had the patient pegged as a derangement before they even got out of their car and walked into the clinic, So, so, so it definitely can be a problem and an issue for clinicians that are new to it, because it is that rapidly changeable one. It looks great. We look great to our patients. They make great reviews, those type of things. But I think we can come, if that's the only thing we're taught, only thing that we're trained in. I think a person that does adhere to the principles can avoid that tendency to make everyone a derangement. So I don't know that it just because that's the only thing that you're educated in or taught in. If you adhere to the principles, I think you can do a good job of recognizing not everyone that's coming in is going to be a derangement, and I can identify those that aren't. Um,
I
but
would agree with that
yeah,
entirely. I sorry to interrupt you, but I agree with you in that if someone is sticking to the principles, they will or should
yeah,
um, gravitate away from the idea that it's a derangement if it isn't a derangement.
yeah.
Um, Maybe that takes some people longer than others, uh, you know, within a person's care or just in general with their practice. But it's no one's fault. I think that's why we call it practice. We're
Okay.
all practicing, right?
Hear the entire episode for free on iTunes, Spotify, other favorite podcast players, or go to mechanicalcareforum.com.